Hello, beautiful people. You're welcome back to my channel. Like you know, I'm Dr. Seni, your favorite public health doctor, and I'm so glad to be here. So now, let me ask you something. When was the last time someone actually sat you down and explained your period to you properly? I'm not talking about whispers, not like someone saying, "Oh, that's your thing has come again." No, not like that. But a real, honest, medically accurate conversation. You know, for most Nigerian women, that conversation never happens. So, and that's exactly what I would like us to have here today. So, whether you're 16 or you're 45, whether your period is regular or is all over the place, this video is for you. So, sit tight because by the end of this video, you will know your body better than you ever have. So, have extremely heavy bleeding. Maybe you're having more than one pad being used per hour for several hours. It's not normal. It could actually be a sign of fibroids, hormonal imbalance, or other conditions. Or if your period lasts more than 7 days, you need to investigate. You need to see a gynecologist urgently. Also, if you're having severe debilitating cramps, pain that stops you from doing any form of work, you cannot go out, you cannot go to school, you cannot carry out your activities of daily living, it could be a sign of endometriosis or adenomyosis. See your gynecologist. Also, if you're having irregular or absent period, you don't see your period and you're not pregnant, it could be a sign of PCOS, or it could be a sign of thyroid problems or extreme stress. Also, if you're bleeding between periods, that's intermenstrual bleed. Maybe you're spotting between your cycles, especially after sexual activity. Please, you need to evaluate further. Also, you're having unusually foul smell. Some odor may be normal, but that strong offensive smell, it may signal an infection. So you need to go to the STI clinic urgently. Also, pain is not something you have to endure in silence. So you deserve answers and you deserve care. So another thing is, let's talk about hygiene, because this is very important too, especially in these our Nigerian communities where access to proper menstrual products is not always guaranteed. That's why I'm working on an initiative, a program I'm working on. I would let you guys know it's time. So here are the golden rules with menses. You change your pad every 4 to 6 hours, even on your light flow days, because bacteria will multiply quickly on pads. So also you wash your hands before and after changing your menstrual pads. Also, you have to clean your vulva gently with warm water. You don't need to use soap into the vagina, or you don't need to douche, you don't need to spray anything inside. The vagina is a self-cleaning organ. It will clean itself. Also, you dispose used pads properly. You can wrap them before you throw them into the waste bin, but please do not flush them because you will block the water system. Another thing is, consider reusable pads. This is exactly what I'm working on. They are affordable in the long run, environmentally friendly. They're very effective. More on this very soon on this channel. I promise you that. Also, you have to stay hydrated. You have to eat well during your period. Feed well on iron-rich foods like beans, green leafy vegetables, fish. They will help you to replace all what your body is losing. So it has gotten to my favorite part. That's the myths busted, because we have lots of myths on menses in Nigeria. Some people say you cannot bathe during your period. Please, it is very wrong. It is a lie. Bathe. Your hygiene is very important during menstruation. Another will say you cannot cook or touch food during your period. Please, it is baseless. That kind of thing is false. Cook. Another will say period pain means you will have difficulty in childbirth. Please, there's no correlation. There's no connection whatsoever. Huh? Some will say irregular periods means you cannot get pregnant. That is not necessarily true. Yes, we know that many women with irregular cycles, they may have some form of delay, but they do conceive. And it is something that you need to see a doctor for. It's not something you should just bother yourself about. You have irregular menses, kindly see your gynecologist. It's not something to kill yourself for. Some will say every period means that you are very fertile. That's not true. Every period can actually be a sign of an underlying problem of infertility or something else. Just see a gynecologist. See, knowledge is power. Share this video with someone who needs to hear it, and I hope this conversation has helped you to understand your body just a little bit better. At least, because you deserve to know it, you deserve to ask questions, you deserve proper healthcare. If you learned something today, please give this video a thumbs up. And if it really helps more persons, it would be nice that you share it so that it can help more persons to You know, this is a content. This educative content is what we should even share, not all those other types. You know, so you can also subscribe to my channel if you have not, because we talk about things that matter. We talk about your health, talk about your community, about your life generally. So drop a comment below and tell me, what menstrual health question do you have, that you've always wanted to ask, but you were too afraid to? Don't worry. I always read every single comment, and I am so sure that one of the questions you asked may just be the next thing I'll talk about in my future video. Until next time, stay healthy. I remain your girl, Dr. Seni, and I'll see you in my next video. Bye.